Practice, continuing ed, and teaching. He maintains his practice in prosthodontics in Marblehead. He graduated from New York University College of Dentistry in 1975 and completed a 2-year advanced graduate study in prosthodontics at Boston University Graduate School in 1978. He served as a dental consultant and lecturer for implant innovations during his formative years. He's co-authored publications on the subject of interdisciplinary implant treatment in the International Journal of Periodontics and Restorative Dentistry. And he's a contributing author of the text Demystifying Smiles, Strategies for the Dental Team. He's served as chairman of the North Shore District, and he's presently our assistant editor of our newsletter. So,
Photographer extraordinaire.
Yeah.
Who's going to take his
all things video. He's got his videographer.
For those who missed, thank you, Darryl.
Nice to meet
A few prompts to There's more steak out there. Those of you wants to lay.
Speak louder, Jeff.
Okay, hold on. There's steak. The steak is ready.
Steak is ready.
The steak is ready now.
Check my script here. Really? No.
He just got the joke.
So this, now I'm going to stay on purpose. But I want to thank your stepson, Eric, at the Apple Store. Where's John? John Herzog, for showing me this. This iPhone controls this. It's been my great pleasure as chairman and great pleasure to work with the District Dental Society and watch it grow and see the young members come along and get involved. As a matter of fact, the new members, we want to go to our newsletter. We had a nominating committee meeting, and I encourage you to mark your calendars. This is for Roger, who's not here this evening, but mark your calendars for the golf tournament and read your newsletter. And this is for Arnie, who suggested we ought to have an ask or invite your colleagues to the campaign to at our nominating committee meeting. And welcome all new members here. Tonight, I'm thrilled to have the opportunity now to address the society in a clinical fashion. And what I'm speaking about is digital smile design. And digital smile design, I heard this evening that you were here because of the topic. New members heard about the topic, and so I don't know how many, by show of hands, are familiar with what digital smile design means. Gary Reiser got it because he's the one that I have to thank for so patiently listening to this. You cursed. Got me to see the forest through the trees.
Something to do with period.
So the question is, what is digital smile design?
How we fix what you do.
And digital smile design is a concept that was developed by Christian Coachman, and the young man over there is Christian Coachman. That was his girlfriend in West Palm Beach. But for those of you who don't know who Christian Coachman is, he also developed the pink hybrid technique for putting pink porcelain on complete dentures or on pontics, and then putting composite on top of that. But in any case, he flies from Brazil to say Galip Gurel's practice in Istanbul, Constantinople, or he goes to Atlanta, and he'll go there for a week as a technician. He's a dentist and a technician, and he practices with his brothers in St. Paulo. In any case, he developed a concept, and the digital smile design, if you want to take a look at this further, is also on the Dental XP website, and you also can see it in some of the trade journals, or the concept of it. With Bill Stroop in Florida and put this in the Glidewell magazine about basic principles of digital smile design. So what is it? So digital smile design is, all right, I'm going to play anything that happens with this doesn't work, I'm blaming it on you. The application of digital tools for the aesthetic design of a smile that influences our diagnosis, our communication skills, documentation, and our case acceptance. Now, that sounds like a mouthful, but without these visual tools, and what they consist of, go back, that's pretty good. What they consist of is a camera and documentation of our patient.
It's not Eric's fault.
This is I'm going to bring you in. There we go. There we go. Now I don't have to hold on. So, it's the camera, computer, and the application. You got to be right on this. The application of either Keynote or PowerPoint. Now, by the show of hands, who knows PowerPoint and Keynote? There we go. Okay. So, without these visual photographic tools and these applications on the computer, we would have to rely upon what we've relied upon for years, which is models, handwritten notes, verbal communication, and articulators to transfer information. So, the key concepts of digital smile design. The key concepts of digital smile design I put together in a checklist. There it is. Okay. In a checklist. And many of the terms you are familiar with, such as midline, canting, horizontal plane, wax-ups, mock-ups. But there's the concept of a digital face bow. There's the concept of a digital ruler, or a facial reference. And so we're going to be looking at those, and by the end of this evening together, we'll have a clear understanding, and it'll be something that will help all our practices, whether a restorative practice or orthodontic practice. It's a big promise. So, the steps of digital smile design. What steps would you do to incorporate digital smile design into your practice? Well, you have the community of, or communities of people that you practice with. You have your office team, and I'd like to thank my office team for putting up with me the last 2 months. Yes. And
Only 2 months?
it started with Diane, who okay, we're getting off subject. Okay. So anyway, so you have your communities that you work around. If you're in practice, you might have your dental laboratory, your interdisciplinary college, you have your patients, and then you have the actions that you're going to take, which is the treatment plan. So now, the first step is to take out the menu, or the key concepts that I mentioned, which should come in. There you are. So you take out this menu, and you use that menu, and you pick from that menu what's appropriate for a given clinical situation. You don't need to have all the key concepts. Like when you look at a menu, you don't order everything on the menu. You want to pick and choose which items are appropriate. So there's the key concepts. And Christian Coachman, this is one of his actual slides from one of his presentations. This is his photographic series that he takes. which has 62 photos, and he claims it takes 15 minutes to take all the photos. I can't imagine. But key in what we're going to be talking about is the portrait photos, and what the portrait photos do for you, because we're all familiar with the intraoral photos and the smile photos of just the dentition. Some of the people smiling, showing their teeth. And some of the tools, of course, are mirror and the retractors. There's some of the more sophisticated things that block out black device. And you apply those when you decide which you need to have for a particular case. So, for example, once you take the photos, you analyze them on your computer using the facial references that you would get from a portrait photo. And that's what we're going to be talking about, how that applies. So now, this is the same person, believe it or not. And this patient came to me 5 years before this photograph. It took about 5 or 6 years to convince this man to have treatment. And the reason that his nose is so big is because I got a better camera by the time I took this photograph.
That's good.
Right. And basically, but this is portrait photography, and certainly when you look at the types of issues that he had, I mean, there's crowding, there's occlusal plane, there's wear, there's gingival tissue showing, and we were able to create a nice balance by doing interdisciplinary care as well as restorative dentistry. And I wrote an article about right around the time when I got the better camera, and if you look at that, one of our members of a district was in a meeting, and I asked her to sit with her feet up on the chair, and you can see how large the feet are using a camera, like a little small point-and-shoot camera. A small point-and-shoot camera comes so close to the object that you're taking a photograph of that whatever's closest to the camera comes out huge. However, when you use a more sophisticated camera with a telephone lens that lets you get to some distance, it flattens the image, and that's why you get a better proportion of the features of the, you don't have a big nose. Now, another thing is that when you have a patient, you're going to define some of the views that you're taking in your photographs. I mean, this is a typical smile view. We have an intraoral, smile, and portrait. I mean, there's only 3 views we're talking about. So this is the smile view. Now, when you look at the smile view, you say, well, where is the midline? Is the midline really something you can verify, that you get a good sense of from a smile view? Well, you get a better view if you get a better idea from a portrait view. I mean, you estimate where the midline might be, but you'd be better if you had a portrait view. And the same thing for where the occlusal plane is. So if you're going to give a technician, or you're going to create someone's teeth, whether you're an orthodontist, endodontist, I don't know, well, you're looking at a patient and using the same criteria. And certainly if you're in general practice doing restorative dentistry, you will. And if you take our menu and you identify the horizontal plane and the midline, and you decide that you really want to get a sense of where it is, you take a portrait view, you begin to develop, or a facial view, where the teeth should bleed, where the midline is. And we'll be discussing the details of how to go about that. But you measure facial references. And the facial references will give you what you need to know, which is the horizontal, and it's been studied that the horizontal plane in a facial view is the interpupillary line that you would draw between the pupils is roughly 90% of individuals. That represents the horizontal. And then the midline and the incisal plane. So that when you get a view and you make that analysis, and this is what we do without having this terminology. Digital smile design is basically giving you terminology for what you naturally do when you look at a photograph. When you look at a facial photograph, you look right away on the eyes parallel to the horizontal. And then you look and you see where is the midline about right. And then you decide where the teeth are. And you basically, what I'm basically doing, something you already know, but I'm giving you, articulating it with, and giving you terms with which to think about it, because when you have the tools, and then you can take it and you can transfer what's called transfer across. You then locate it on the smile view, and that's transferring this to other views is what we're going to be talking about and developing conceptually. And then practically. So, let's just get back to the steps. So the second step is to communicate with your team and interdisciplinary colleagues. So, again, I thank my team for something more than putting up with me. I thank them for, okay, stay up with me a second. So the second step is to communicate. So here's us in our office. This is looking at a case, a patient's treatment, and you have, by having the presence of a facial view, you can talk about what you're going to be doing in the patient's mouth if they're either coming in or the next day or they're in the chair right now. You basically can sit around and do like grand rounds, and you might be discussing whether a patient's wife called and said, well, you know, the teeth he made are crooked, or they're too white, they're too big, he's too toothy. This is a provisional he has on. And somebody could say, well, I saw him in the supermarket. In other words, when the office gets together, you can put the information together. And now, the interdisciplinary application, certainly if you're working together on a case, you can use the digital tools to enhance your communications beyond photographs and notes. Now, this is the planning an immediate load on a mandibular implant case, and how many implants are we going to place, where are we going to place them, how are we going to space them apart, and the whole discussion can be enhanced by some either email communication. And another example, this patient, there's a wear case that came into my office, and thank you, Bill LaBelle. I have a lot of thanks here tonight. This young lady came into my office, and she was 21 years old, and she had wear that was from, and she was graduating college, and she had started college when she was about 17, and within 4 years she had been prescribed Celexa for attention deficit. Well, there's all kinds of attention deficits, but I've been accused of it as well.
By the way, your pill was supposed to be in.
Right. But anyway, so in any case, as a side effect, it has side effect is tooth grinding. And on a young person in college who takes this, and she had this tooth wear, she came into my office, and quite frankly, to take a young person like this, referred by Bill LaBelle, thank you, Bill, I wanted to do good, I mean, to crown all their teeth, and so I consulted my interdisciplinary colleagues with digital tools. after I had documented her case. She came in, I said, I can do it. And she said, okay, good. And then she left the office. Now I'm saying, what am I going to do? So, coincidentally, the way the world is, things happen for a reason. Jay Lerner had been at the Cambridge Study Club right around within a week. And Jay Lerner is, for those that maybe don't know, he lectures on aesthetics and inclusion, and he had written a paper in Practical Procedures in Aesthetic Dentistry, and he had presented this paper at the Cambridge Study Club, and he basically talked about a systematic approach to full mouth reconstruction of severely worn dentition. And this paper just so happened to address what to do when you had a patient. It was just like the patient that walked into my office. And so I know Jay Lerner, I called him up. I sent him that little collection of clinical pictures, so he basically could see exactly what I saw in my practice, as if the patient was sitting in a chair, and I could discuss with him the nuances of how to go about using I knew how to use a leaf gauge. You can see a leaf gauge, and we're going to go into a little more detail in this case, but from his writing the article and his experiences and sharing it with him, it certainly, well, you'll see the results of this case. So, the third